There were a lot of questions regarding peptide therapy, so I thought we would revisit this. Um,
Okay.
so the first one, I know it's the RG3 nasal spray. And so, RG3 has many, many health benefits. It includes anything from like mental clarity to decreased stress, heightened concentration, and really just kind of an enhanced immune response, increased energy. So, for those out there who are interested in RG3 nasal spray, it is a nasal spray that you insert 1 to 2 sprays in each nostril 2 times a day. Now, some people do 1 spray twice a day, some people do 2 sprays. And Wendy, you can even speak on your own experience here. So, basically, this is made up of ingredients that are neuroprotective. So these are what we call neuroprotective and neurorestorative, and it's made up of this ginseng and vitamin B12. So it really helps to um, kind of suppress those pro-inflammatory cytokines and regulate the activities of any type of inflammatory signaling going back and forth. So again, it's in terms of the duration of use, you could use it twice daily here on out. You don't have to necessarily take any breaks. The typical treatment, we like to say at least use it for 8 weeks to see kind of those effects. Some folks do it short term, some folks continue long term. Really, no side effects from this aside from some mild nasal irritation, and that's sometimes more operator error kind of thing, but no long term side effects have been reported. And then also no type of contraindications or medication interactions. So that's really nice. The interesting thing about ginseng root is it has been used in Chinese medicine for centuries. And so again, we've known that this has just very neuroprotective properties and, just helps with cognitive function. It also helps to support the microglial activity in the brain cells. So again, think neuroregeneration and rejuvenation of the mitochondria of those microglial cells. And who is this for? So this could be for everyone. It is just great for anti-aging. So even if you don't, have this significant brain fog or history of, like concussions, or you don't have to have this great neurological history to be taking this and to see benefits. So this is just good. It could be used, for everyone. Nice cognitive support and anti-aging tool. The other one is called BPC 157, and I know we've talked about this one before as well. So this one stands for body protection compound. And so basically it's composed of 15 amino acids. And believe it or not, it was discovered and is isolated from human gastric juice. So the cool thing about this is that even if you take it in oral form, because it's offered in subcutaneous and oral form, it is not broken down. So it's absorbed in your gastrointestinal tract. It's not broken down. So you can have full benefit from either oral or subcutaneous types of administration. And I leave it up to the patients just depending on what they're comfortable with. The benefit of this BPC 157 is it really helps to heal tissue. So it's, again, neuroprotective, cardioprotective. But the big thing with this is it really helps to stimulate what's called angiogenesis. And so that is basically stimulating new blood flow to an area for healing. So when you really want to start this is after there's been some sort of acute injury of some sort or acute illness, and then continue that on for those, most beneficial healing properties. Now, that's not to say that for those who've had these chronic issues won't benefit from this just as well. Absolutely. So it's very anti-inflammatory. It's cytoprotective. So it really, it protects those cells and accelerates that healing. Gut health, it is phenomenal. I mean, this is one of the major reasons we use it because it combats leaky gut and irritable bowel. Anybody with gastrointestinal cramping or like a history of Crohn's disease, will really benefit from this. It helps to improve digestive function and just really kind of maintain that mucosal lining of the GI tract. So it's just really there to heal and repair, protect. And again, it's stable in human gastric juice. So this can be given subcutaneously. So it's just this tiny little needle that you can inject in the subcutaneous tissue. And you would do that daily, or you could take it orally as well. So again, I say it's usually whatever the patient kind of just has a better feeling about. I mean, we can switch back and forth. Some feel that the oral is more beneficial, some feel the subcutaneous is more beneficial. So definitely support in gastrointestinal healing, joint health. It's huge with any type of musculoskeletal injuries, joint health, but also just cognitive performance and overall cognitive repair. So that is probably one of our most commonly prescribed peptides. This was actually, it's interesting, this one was actually discovered in, I believe it was Croatia, by a team of gastroenterologists. So it's just kind of fascinating, just the information they have. They've done numerous animal studies and just the anecdotal studies that they have and stories that they have on the patients. It's pretty impressive, the benefits that you can. Okay, so those are two amazing peptides. And then we have a third one, and you might be familiar with this one, DHHB. So this one is amazing for those who suffer from any type of anxiety, which is, a large part of the population. And we know that anti-anxiety medications like benzodiazepines, they might help with the anxiety, but then they also produce these side effects that, can be very worrisome. They also have harmful side effects and drug dependency risks that come along with it. So the DHHB is actually a derivative of magnolia bark. And this has been used for, in traditional medicine in Southeast Asia for centuries. So this actually has potent anti-anxiety effects and neuroprotective properties all at the same time. So it's found to be much more beneficial than like a Valium or Xanax without the harmful side effects. So you don't have that sleepiness and the drug dependency risks that come along with those benzos. So what happens is, how this works is it helps to enhance the GABA neurotransmitters. So they have a very calming effect on the brain, which can help, promote sleep. It can help reduce your anxiety level. So it really, truly is a great anti-anxiety agent, but it's also an antioxidant. So it can help with inflammation and oxidative stress. With this one, it's nice because you don't have to take it every day if you don't want to. You can do one capsule. We usually recommend 1 to 2 capsules daily as needed. The only thing with this one, I don't like to combine it with any type of prescription medications. And then definitely, no, I don't like to combine it with alcohol. Again, it does not cause any type of sedation, but I just prefer it to be kind of by itself. But it's nice because you don't have that sedation or like muscle relaxation. So, with those benzos, if you're taking it and you're having to drive somewhere, you're sleepy, there's a lot of risk that comes with. So yeah, this is a nice one for anyone who's just kind of struggling with anxiety, even needs a little help with sleep. And again, it has that immune modulatory effect. So it can be very beneficial for those who have these kind of inflammatory states that they're struggling with. So those are probably our top 3. Obviously, there's many, many more.